Hello, everybody. Welcome to my channel. Have you heard the saying, the, oh my God, the nurses eat their young? That's something that I've heard. I know of some nurses, and I've seen it in so many comment sections of nurses saying they're quitting nursing. There has been an increase of nurses quitting because of burnout, bullying on the job, doctors mistreating them, patients mistreating them, the family members mistreating them. A whole lot is going on now. I believe that just as many nurses are quitting, you always have new nurses coming in because when you look on social media, there is this aesthetic of nursing of glamorous, your cute little scrubs and your cute pins, and you're making all this good money. Okay, traveling nursing, whether you're an LPN or an RN, you have different look, healthcare period, there's a lot of burnout, whether you're a CNA, LPN, RN, nurse practitioner, and so much more. And a lot don't know what they're going to do because it's not easy being a nurse. You have to pass the NCLEX. It's hard. Those tests are hard. People feel like I spent all this money to get this damn degree or to get this certificate. What am I going to do if I'm not doing nursing? And some just say that the hell with it. I will figure it out. I can't do it anymore. I've seen nurses who have been nurses for over 20 years in comment section saying, I will never do bedside again. I am done with it. They eat the young, they eat everybody. Tends to be a women dominated field. And any woman who's worked with a lot of women, you already know. And I keep seeing people talk about the bullying. I don't know. I want to share this video with you to show you what's going on, that there are a lot of nurses who are quitting. But when you see these videos, if you're thinking about being a nurse, don't let, look, just give it a try if it's what you want to do. But to me, if you don't have patience, you shouldn't be a nurse. If you don't have empathy, you shouldn't be a nurse. If you can't take seeing people pass away or getting very sick and it really affects you mentally, emotionally, you probably shouldn't be a nurse. Okay. It takes a lot. If you can't multitask, you probably shouldn't be a nurse. So, and there are people who have all of those traits and qualifications, and it's still overwhelming them. And a lot of nurses, unfortunately, are quitting. This is the reality. Yes, there are a lot who are still getting into it, but there are just as many who are quitting in very high numbers. Check this out.
People don't understand what nurses are up against. Imagine showing up to work and everyone around you is just pissed off and burned out and going to quit their jobs. That's what it's like for nurses every day. Oh, they're also extremely understaffed. Imagine doing the work of 2 to 3 people just for your job. That's what nurses have to go through every day. Oh, and the patients are brutal. Workplace violence is way up for nurses, and they also have to deal with their own safety when showing up to their job. I just can't imagine being a nurse in this country right now.
I had to come in the car on my break because I'm just so irritated, y'all. The healthcare field is just so trash, bro. Management, trash. Doctors, trash. Doctors get mad at you because you don't understand what damn order they trying to put in because they talk too damn fast. And you got to keep up with them, and I can't keep up with you because I really understand what you said, okay? Attitudes, like I said, trash. Attitudes, trash. Attitudes are trash. Some of the CNAs get mad when you ask them to do something. I'm not a nurse that's going to tell you what to do. I'm going to ask you because I'm not your mama and I'm not your boss and I'm not the head. I'm the person who is the nurse of the floor, but we all in charge around this hall. I'm not doing this by myself. But if I ask you to do something, just do it for me. And it's all about delivery. Y'all, when I come to work, I'm the one that set the tone. Almost everybody loves me. Wherever job I go to, almost everybody loves me. But you got them few people that got them attitudes. Management be trash. Attitudes, trash. Attitudes, trash. Attitudes, trash. Entitlement, trash. People want to come in and say what they're not going to do. That's the first thing people do when they come into the healthcare field. That's the first thing people do when they come to work. They say what they're not going to do. They don't even thank God for the day. They come to work and say what they're not going to do. And me, I'm the nurse just like, okay, let's try to figure it out. Because I'm never going to give attitude. Like, y'all, the way y'all see me on my page, that's how I am in real life. And that's how I am at work because I know how hard work is. But I'm gonna bring that good energy. I'm gonna bring some donuts. I'm gonna set the tone. That's why people love to see me. But like, just when I work with people, when I work with new patients, I work with new residents, they tell me how, like, you so nice. I ain't been treated this way in a long time. Like, what are y'all doing? Healthcare field is trash. It's trash. And it's annoying. Like, it's so, people are going to school for nursing and going to school to be a CNA and a CMT just to be trash. Y'all just doing this for the money. Y'all not doing this for the passion. It's trash. I need a nigga to come run that bag on me because I'm tired of it. But let me go back in here and let me go back inside and put on face. Your favorite nurse.
You people wonder why there's a shortage of nurses. You people wonder why a nurse goes and works a fucking year to get her experience and then they leave the bedside. Everybody wants to know, why are the nurses leaving the bedside? Because you people are fucking abusing us. You're abusing all of us. Everybody. You get disrespected by the doctors. You get disrespected by the family members. You get disrespected by the fucking patients. You get disrespected by the fucking registration. Every angle and every time you turn around, you are disrespected. Disrespected by management. Disrespected by your coworkers. Every single fucking day. Every single day, you're getting abused. Verbally, physically, mentally. All avenues. You're just taking a beat down from every single fucking angle. It's not fair, and quite frankly, it's not enough money to be getting fucking abused all the time. I clock in every day for 12 hours on my feet for fucking 12 hours straight, get my ass beat, wipe up people's shit, get shit thrown at me, get pissed on, get thrown up on, get fucking disrespected, get fucking yelled at, all of it. All of it. And all I'm trying to do is take care of the people that you love, or you, and you don't even want to take care of you. What the fuck? What the fuck? What the fuck? What the fuck? Everybody wants to argue about fucking everything. You're literally trying to help people and they're arguing with you. Like today, I go into a patient's room and I literally say, hi, would you mind if I stock some of the things that are in your room right here? Is that okay? And they're like, yeah, it's okay, no problem. Patient continues to ask me, can he have something to eat? I told patient, no, sorry, you can't have anything to eat right now. Unfortunately, you have to be fully worked up and have all your scans done before you can eat or drink right now. Provider would have to say otherwise. And he continues going on and on and on about he wants something to eat. He just wants this. He just wants that. And I'm like, honey, I'm so sorry. That was a great convincing, but you cannot have anything to eat. The doctor has to say you can eat. Okay, so his family member at bedside stands up and says, what do you want? I'll go get it for you. I told you they're all the same. I told you that they're all like this. I'm like, ma'am, he cannot have anything to eat until he gets all his scans and stuff done. That's why I just said what I said. She looks at me and was like, and I said what I said. And I'm like, okay, all right, you know what? Okay, fine. You know, and I tried to sit there and continue stalking, the stuff. The whole time, I'm literally saying to them, let me finish stalking this stuff right here, and I will go ask a provider. Maybe they've changed their mind. Give me a second. Give me a minute, and I will go ask the provider. Just give me a minute, and let me finish this, and I will go see if you can have something to eat. No, that wasn't good enough. She had to stand up and argue with me and literally yell at me because I'm trying to keep your family member safe with the most accurate test results so that they can get healthy and feel better and leave this fucking emergency room. Why am I the target? Why? Why? Then I pull my nurse aside and I'm trying to tell my nurse what happened in a corner in a private area, and here she goes ripping and running around the corner. This one right here, she's nasty. She's nasty. All I said was he cannot have anything to eat right now. That's why I just said what I said. She's like, yeah, you're nasty. I said what I said. I said, ma'am, that's not what I said. And she was like, oh, so you didn't say that? And I'm like, I did, but you're taking what I said out of context. The doctor has to say he can eat. That's why I just said what I said. Am I tripping? Bruh. And then she pulls the nurse aside and she's telling the nurse that I'm nasty. I don't have the authorization or the right to say that he can't eat. Mind you, I don't know if she just thought that I was just somebody stalking his room and I can't say that he can't eat. I am a part of his primary care team. I'm literally the tech taking care of the patients in this bay. The abuse literally has got to stop. It has got to stop. I can't. And y'all are wondering why nurses are getting their experience and they're leaving. Or nurses are literally working less than a year at the bedside and deciding, I shouldn't even have pursued this career. I don't want to be a nurse. This isn't for me. This is unhealthy. Yeah. Thanks for coming to my TED Talk.
Here's why nurses are actually quitting, and no, it's not because we're lazy or we don't love the job. Let's be real about why so many of us are walking away from the profession. Reason number one is unsafe staffing. Almost every nurse I know says their unit is short. You walk into a shift already behind, 4 or 5 really sick patients in the ER or ICU with no tech, no secretary, and leadership still claiming it's safe on paper. You're set up to fail before you even hang your first med. Reason number 2 is burnout and mental health. Burnout isn't just being tired. It's that mix of physical exhaustion, emotional numbness, and this voice in your head that's just saying, you're failing everybody. You go home wired and empty at the same time. You're snapping at your family, sitting in your car after a shift, just staring, trying to convince yourself to go back tomorrow. Reason number 3, toxic leadership and gaslighting. You speak up about patient safety and ratios and get told that's just how it is. You'll toughen up. We all did. They send out self-care emails and pizza parties while ignoring every single thing we're telling them. And we tell them everything that's about what's really going on at the bedside. Reason number 4 is work and family. I mean, you work 12-hour shifts that turn into 14, rotating days and nights, back-to-back weekends. That might be survivable when you're 22 with no responsibilities. Try doing that with kids or as a new dad or while taking care of your own parents. At some point, you have to pick your job or being present for your actual life. That's why nurses are quitting. Not because we woke up one day and stopped caring. It's because caring in this system costs you your body, your brain, and your family. While the people in charge refuse to change anything that matters. If this sounds like your last shift, tell me in the comments, what kind of unit are you on? What's the number one thing pushing you out? No hospital names, just real reality, just your reality. And if you're done feeling trapped by this system, but have no idea what else you can do, hit follow. I'm an ER nurse building off-shift income and an exit plan so I can be present and leave this mess behind. And I'm sharing everything I learn as I go.
I quit clinical nursing in 2017, and here's why. First of all, the bullies. When it comes to nursing, I don't know if people are miserable. Like, I am not sure what it is, but I was bullied, and a lot of other nurses, especially Black nurses, were bullied severely in nursing. They would give us the worst assignments. Like if the other nurses were in charge, like I was getting terrible assignments, especially if I had the nerve to speak up against anything that was going on. Suddenly I would be placed with, those doctors that nobody liked or, the most difficult patients. And I would somehow always have the most difficult patients. It was way out of pocket, and I was just sick and tired of dealing with all of these crazy people who really are just miserable themselves and are bringing that misery into the workplace. When you work clinically, it seems like there's only a limited number of directions that you can advance and expand your knowledge. Like you could be, a clinical subject matter expert. Like there's a couple other things, or you could go into operations or become a nurse manager. But those roles are few and far between, and there wasn't like that limitless potential that I was really looking for when I first went into nursing. And the third reason is personal. When I was in high school, I really always saw myself interested in business. I saw myself getting a business degree, starting a business potentially, like understanding finance. I was really always into finance, and nursing was just like not really giving that to me, at least not the clinical side. And then work-life balance. When you are a clinical nurse, it was better in primary care, but like if you work bedside, there's no work-life balance. Like you're working crazy hours. You don't get to go to holidays with your family. I remember my family, they were going to I think it was like $5 Tuesdays at the movie theater, and I had to work Tuesday nights. So I was never able to go. And that was like really upsetting to me that I just couldn't control like my own life outside of working hours because like I was working clinically as a nurse and I really wanted that work-life balance. I left in 2017 and I have never looked back. Like, I'm loving my desk job. I know people talk a lot about desk jobs, but I'm loving it. Like, it is amazing.
These new nurses really be pissing me off. Like, I don't know what they expect, like, nursing was supposed to be. Like, everybody's supposed to be walking around in these cute fucking joggers with their scrub tops tucked in and their Stanley Cups and their fucking bog bags. And it was gonna be all fucking flowers, peaches, and cream. I literally just had a nurse tell me to my face that she didn't become a nurse to do aid work. What the fuck is aid work? We all supposed to be here taking care of these patients. Do you think because you got some extra letters behind your name, you're not supposed to wipe nobody's ass? Like, some of these people's coming into nursing for all the wrong fucking reasons. Want to come to work like it's a fucking fashion show, portraying it like it's something that it's not. We all work together. Nurses, aides, whatever the hell you are. We all work together as a team to make sure these people get the care that they need. But to say that you didn't become a nurse to do aid work, like, is beneath you, is just another reason why I'm already starting to get burnt out in this profession, because future nurses, please make sure that you want to come into this profession for all the right reasons, because you actually care and want to, take care of people, not for solely a paycheck or the cute aesthetic that comes with being a nurse. I mean, shit, look at me right now. I look rough as fuck. I'm on my 4th 12. But please come in and do it for all the right reasons. Because we need people that want to do it for all the right reasons.
My name's Chelsea, and I am walking away from the field of nursing. I am actually on my way to a 12-hour shift right now, but today I just really realized, like, my body remembers all the trauma and all the heartache that I've gone through over my nursing career. And it's not my patients, and it's not the coworkers. It's just the healthcare system in general. And while I am not worried about who I'll be working with or, like, the patients that I have, I know that, like, I'll be taken care of with those situations. It's just remembering that whenever I was 6 weeks postpartum with my first baby, and I was a brand new mom, scared, and leaving my brand new baby with my husband, who was also brand new dad and very scared and very capable, but scared. And I was off to work. And that, I think my body remembers that. Like, I think my body just remembers, because I get nervous. I get anxious coming to the hospital to work. Again, not because of the patients, not because of the people that I work with. I love the people that I work with here. But just the healthcare system overall, and the pressure that it puts on nurses to be perfect, and just to, like, I don't know, in things that when it comes to patient care doesn't matter. And that is hard to navigate whenever you're also trying to take care of a family, and you're also trying to, like, make sure that everyone else in your life is taken care of. And I think that is why I need to get out. I think that's it. Like, I think that's it,
40% of nurses gone by 2029. That number is coming from the same regulatory body that issues a nurse their license after they pass their board. They say since 2022, 138,000 nurses have left the workforce. And by 2029, that's within 4 years, about 40% of nurses intend to do the same. That's almost half. Let that sink in. I know what you're thinking. What the hell? What gives? So let's look at some of the factors. Fatigue, being assigned too many patients and everyone needs you every 5 seconds. Eating things that are fast, easy, and usually terrible for you just because you need the energy. Disrupted sleep for a number of reasons, but new graduate nurses are indoctrinated into night shift and they're very hard pressed to find a day job. They're usually beat out by nurses with experience who want those positions. Long hours. The standard is a 12-hour shift, but that usually turns into 13 hours by the time you're done giving a report on everything. Most nurses are too exhausted to exercise after a shift, and if you work a heavy floor, which most are, trying to exercise before a shift is almost like signing up for a death sentence. Another factor is stress on the job, and I'm not talking about a report deadline. I'm talking about trying to save a 5-year-old's life and they end up not making it. Try not taking that one home. And as sad as it is, yes, there are some older nurses who still bully the new ones. That's called lateral violence, and I'll cover that in another video. And for all that we do, there's very little research that exists on nurses' nutrition, stress, and overall quality of life. So what impact does this have? Well, it sucks to be a nurse. Nurses are not happy, and they're also not stupid. And an alarming proportion of the remaining ones are looking to leave. The ones who had the means to leave have already left the profession. Some might say, so what? Just train more nurses. That's a great idea, except 1/3 of new graduate nurses report intent to leave. But the actual number of new grads that end up leaving the nursing profession altogether is somewhere between 43 and 56% before year 2. The picture that these statistics are painting is looking pretty grim. So the moral of the story is, be nice to your nurse. They're struggling more than you know. If you've left nursing or are thinking about it, leave a comment below as to why. Shout out to all my techs, CNAs, paramedics, EMTs, and EVS crew. I know you're right there with us. If you found this video informative, like, follow, and share, and thank you for watching.
So this is maybe a hot take. This is maybe a little controversial. But I can almost promise you that unless nursing is like your calling, like the career that you've wanted to do since you were little, that you are going to hate it. And for all extensive purposes, I'm talking about bedside nursing. There are plenty of other fields of nursing. This is bedside nursing, which is what most nurses get into, at least to start, because it pays the best and the schedule is the best. We only work 3/12s. And don't get me wrong, I have made some absolutely amazing friends through nursing. I've met some amazing people. I've met my best friend, one of my best friends through here. I'm so thankful for all of that, you know. But nursing itself is not worth it. No. Bedside nursing? No, definitely not. It has changed me, like, mentally in ways that I'll just never be able to fully get back. You know, and I just feel like they don't really like tell you about this. They don't really, and maybe it's like my own fault for not like having the forethought to think. And I'm not talking about like the traumatic like events that we watch. Like I actually have no problem with those. Like it's not like the trauma that I'm like witnessing visually. I'm talking about like the way that like you see a different side of humanity. Like you see like the disgusting, vile parts of humanity. And like, yeah, so once you see those parts, I just feel like mentally it has completely changed and like rewired my brain. And it has made me, I guess, a lot more like jaded myself, which is kind of interesting. And maybe that's just because I'm burnt out. But if I could go back in time and like change careers, I would. I really would. I truly would. You know, a lot of people like probably are going to say no, that they wouldn't. I 100% would. I'm one of those people. And I had stumbled across someone's like profile the other day, and she was saying like, oh yeah, you know, I'm really thinking of going back to school, and I'm thinking about going back to school for like bedside nursing. And the way I had to hop in those comments, and with as much like gusto I could physically type, I was like, girl, don't fucking do it. So just some food for thought. Does anyone else feel this way?
I honestly commend people who quit nursing and who drop out of nursing. I have more respect for the people who know it's not for them and don't do it than for the people who know it's not for them and go to work every day and do half butt work, or like always have a stank attitude. People who make the work environment very hostile because they're miserable within themselves. And instead of going to find something else that better suits them, they make all the other co-workers miserable too. They make work a living hell. So I commend the people who say, hey, I don't have the heart, and just quit, than the people who you have to work with And every day it's a problem because they're not happy within themselves and they know they don't really want to be here. But because they like the paycheck, they stay, they make the patients miserable, and they make everyone around them miserable. Co-workers, everybody. And they make everyone's life a living hell, even the patients that they're supposed to be taking care of. So kudos to you, good job. And I commend the people who just say, hey, this is not for me, and walk away and quit and go find something else. That's actually making everyone's life better. It's making everything run more smoother. It's making it so that the people who are in the field actually want to be there. And the people who aren't really cut out for it, the people who realize they don't actually want to be there, they leave and they go do something that makes themselves happy.
What are some of the big red flags that nurses should be aware of that they're not aware of?
Managers telling them that they've heard from coworkers such and such about them, or they've heard complaints from patients. And then you ask for an example. Oh, they asked to remain anonymous. I can't share that with you. Well, okay, but you're telling me this every week. Clearly, there's a pattern of targeted harassment. So until you are willing to give me the information so that I can make an informed decision to explain what actually may have happened, what you're saying either isn't true or it's one-sided and you're not giving me an opportunity to defend myself. That happens all the time. They target a nurse, they make it miserable in hopes that they'll quit so they don't have to fire them. The reality is that a lot of nurse managers and nursing leadership is toxic, and they never think it's them. If you have a very high turnover rate of nurses, that is a reflection of management.
These are the top 3 reasons why I quit adult nursing, and I would actually rather go back and change careers than to ever have an adult patient ever again. And number 3, my patient had a hemoglobin of 5, then accused me of trying to poison him, and then he AMA'd. And usually when you AMA, it's a lot of education and paperwork. No, this guy just got up and left, and to this day, I have no idea what happened to him. At number 2, my patient said that he's going to track me down and find me after he read me my exact address. And I learned that day, it's a lot easier than you think to find out where someone lives. And for a good 3 months, I was incredibly scared to walk to my car and just live at my house. And at number 1, my patient punched me in the face. And yeah, it hurt a lot. And yes, I did cry a little bit. But the worst part about this was my manager just blamed me. She didn't ask me if I was okay. It was just, oh, what'd you say to the patient? What could you have done differently? Here's some more modules. And after that day, I was just like, yeah, you know what? I'm going to the pediatric floor.
I left nursing 6 years ago, and the number one question people ask me is, okay, so what do you do now? I love my job. I'm making 6 figures. I work from home. Like, it's really great. A lot of times, other nurses want to branch into this. I'm currently working in quality improvement. So the way to think of this is oftentimes hospitals, healthcare systems, doctor's office, they want to see how good they are compared to other hospitals. And so in order to do that, they have to measure their quality. There are a bunch of different ways to measure quality. A lot of times the government will measure. There are often like U.S. News and World Report will come up with different metrics to measure quality. Think of things like how many of your patients are up to date on their vaccine. Are you screening appropriately for cancer? Are you treating this disease appropriately? My job is to look at those measures, look at that data, and figure out ways to help practices or help the hospital figure out how to improve what they're doing. So I have multiple different projects that I work on, and I work with these specific teams, and we come up with a bunch of ideas, and then hopefully at the end, our quality will improve based on these measures. It's an awesome job. I love it. Comment if you'd like to know more about quality improvement and what my day-to-day looks like.
The worst part about being a nurse is not the patients, it's not the doctors, it's your coworkers.
When I was a new grad nurse, I actually had my preceptor go to my manager and tell her, she's not ready for ICU. You should probably send her to the med-surg floor. And I had another preceptor go to my manager and say, she's a solid nurse. She may need some more work on her drips, but she's a good nurse. Don't send her to med-surg. She did all of that, and she continued to smile in my face like she liked me. It's the pettiness of nursing, right? It's the micromanaging, the bullying. It's really weird. It can be very clear. So the people that you have to spend 12 hours a day with are the people that are going to be your problem. You may actually make some real friends, but remember, most of those people are your coworkers, and keep that line solid. Make sure you remember, you don't need to see my social media page. You don't need to know the intimate parts of my life, because they will use it against you. They will tell other people about your life and talk about you behind your back. So be careful. This is Travel Nurse Michelle. Make sure you follow me for more travel nurse content and nurse content. Bye.
So y'all, tell me why I just left the interview, okay? And the interviewer goes,
what kind of job are you looking for? I'm like, yeah, I'm looking for something more stable. I was doing travel nursing, something that I'm not going to be burnt out in. So that she goes, stop right there. I'm like, what? She goes, you don't want to be burnt out. I was like, no, I just want somewhere that I can have support, somewhere. She's like, no, sometimes you're going to be working by yourself. Sometimes patients are critical. You're going to have more than one patient. You don't want to be burnt out. Like, sometimes we go past our hours. We're expected to be here. Sometimes we're in early. Sometimes we stay late. Like, why is me saying I don't want to be burnt out a red flag? Why can't nurses just want better for themselves? That's all I had to say.
Okay, so that is it for today's video. And I want to know, what do you think about that? Do any of you who follow me, are you in healthcare? Are you a nurse? Are you a doctor? What position do you have in healthcare? Has it been overwhelming for you? Is there a lot of bullying? Give us some examples of the bullying that goes on in healthcare. What happens? Tell us in the comment sections if you can. Some of the things that happen on the job. Like I said before, I've heard of nurses lying on other nurses, saying they didn't pass out their medicine, getting someone fired. These type of things do happen. But tell us what happens with patients if you can. Sometimes you go through racism with the families and the nurses and doctors. All types of stuff goes on, okay, all over the place, and not feeling appreciated sometimes, working, having so many patients you have to see, and you're not a robot. You can't do it all. You need help, and having quotas to fill and all this other stuff. Let us know, please, in the comments section what is going on if you can. Are you experiencing this? Can you relate to these women? And what would you do if you weren't nursing? And what kind of other fields can you get in with the type of healthcare degree or certificate that you have? Maybe you might help somebody out in the comment section, okay? So please like, share, and subscribe. I'll talk to you all later. Bye, everybody.